A stroke can happen suddenly, and when it does, every second matters. The faster you act, the better the chances of reducing long-term damage. Today you will learn the simple, 3-minute trick seniors should use before help arrives, one that may help protect the brain while waiting for emergency responders. This does not replace treatment, but it supports the body in those critical early moments. 1. How to recognize a stroke fast. A stroke or brain attack can happen suddenly, often without any painful warning. It occurs when blood flow to an area of the brain is cut off. When this happens, every single second matters. For each minute a stroke goes untreated, the brain loses nearly 2 million cells, which can lead to long-term disability or worse. This is why the #1 goal is immediate recognition. Knowing the signs can save a life and preserve quality of life. The easiest way to remember the most common symptoms is with the acronym FACE-T. F is for face drooping. Ask the person to give a big smile. Look closely. Does one side of their face seem to droop or feel numb? Is their smile uneven or lopsided? This is a classic sign. A is for arm weakness. Ask them to raise both arms straight out in front of them and hold them there for 10 seconds. Watch to see if one arm drifts downward or is unable to rise at all. This weakness or numbness can also affect one leg. S is for speech difficulty. Ask the person to repeat a simple phrase like, "The sky is blue." Is their speech slurred? Are they hard to understand, using the wrong words, or unable to speak at all? Confusion or trouble understanding you is also a warning sign. And T is for time to call emergency services. If you see any of these signs, even if the symptoms seem to disappear, call for help immediately. Note the time when the first symptoms appeared, as this information is critical for medical professionals. Some experts also use the acronym B-FAST, adding B for balance, a sudden loss of balance or coordination, and E for eyes, meaning sudden trouble seeing out of one or both eyes. Do not drive the person to the hospital yourself or wait to see if things improve. Paramedics can begin life-saving treatment on the way to the hospital. Recognizing these symptoms early gives medical teams the best possible chance to intervene, stop the stroke, and protect the brain from further damage. 1. The 3-minute trick that helps protect the brain. Once you've called for emergency help, the clock is still ticking. The minutes between that call and the arrival of paramedics are not just a waiting period, they are a critical window of opportunity. During a stroke, the brain is starved of oxygen-rich blood, and every moment counts. This is where a simple, yet powerful, 3-minute technique comes into play. It's a first aid measure designed to support the brain while you wait. The core principle is straightforward. Optimize blood flow to the brain while simultaneously helping to reduce the dangerous buildup of pressure inside the skull. Think of it as creating the best possible environment for the brain during a crisis. Step 1. Immediately and safely sit or lie down. A stroke can disrupt the brain's communication with the body, severely affecting balance and coordination. The risk of a fall is extremely high. A fall could lead to a secondary injury like a fracture or head trauma, which would tragically complicate an already life-threatening emergency. Don't try to walk to another room or get a glass of water. The priority is to get to a safe, stable position on the floor or a sturdy piece of furniture right where you are. This single action prevents a bad situation from becoming much worse. Step 2. Gently elevate the head and shoulders to about a 30-degree angle. You can use pillows, a folded blanket, or even a rolled-up jacket, whatever is nearby. This specific angle is a delicate balance. Lying completely flat can increase pressure inside the skull, which may worsen brain swelling. On the other hand, sitting fully upright might make it harder for the heart to pump blood up to the brain against gravity. The 30-degree position is the sweet spot that helps fluid drain from the head, reducing pressure, while still promoting healthy circulation to the brain. It's a small adjustment with significant physiological benefits. Step 3. Stay as calm and still as possible. While it's natural to feel panicked, any unnecessary movement, agitation, or stress can cause a spike in blood pressure. This puts additional strain on already weakened blood vessels in the brain and can potentially worsen the stroke's impact. Focus on slow, steady breathing. If you are with someone having a stroke, speak in a calm, reassuring voice. This stillness conserves precious energy and helps stabilize the body's systems, creating a calmer internal environment that supports the brain. This 3-step positioning technique is not a folk remedy. It's a simplified version of protocols used by emergency medical teams. It directly addresses the immediate threats of a stroke by helping to reduce brain swelling, supporting vital blood flow, and ensuring the airway remains open and unobstructed. The best part is that it is safe, requires no special equipment, and can be done in less than 3 minutes. To be perfectly clear, this technique is not a cure for a stroke. It will not reverse the damage. However, it is a crucial stabilizing measure, a bridge to professional medical care. By taking these simple actions while waiting for help, you can play an active role in protecting the brain and giving the person the best possible chance for a better outcome. 1. What you must avoid. Once you've called for help, the waiting period is critical. In these moments, our first instincts might be to offer comfort with a glass of water or a common pain reliever. However, during a stroke, some of the most well-intentioned actions can be incredibly harmful. Knowing what to do is just as important as knowing what to do. Here are the absolute must-avoids to ensure the person's safety until paramedics arrive. First, do not give the person anything to eat or drink. A stroke can paralyze the muscles in the throat, a condition known as dysphagia. This severely impairs their ability to swallow safely. Even a small sip of water could go down the wrong way, into the lungs, leading to a serious risk of choking or developing aspiration pneumonia. Second, do not give them aspirin. While aspirin is a blood thinner often used for heart attacks, not all strokes are the same. Most are caused by a clot, but some are caused by bleeding in the brain. Giving aspirin during a bleeding stroke can make it catastrophically worse. Only medical professionals, after performing a brain scan, can determine the stroke's cause and the correct treatment. Third, do not administer any blood pressure medication, even if it's part of their daily routine, unless it's their exact scheduled time. The body sometimes naturally increases blood pressure during a stroke to force blood past a blockage. Lowering it suddenly can disrupt this delicate process and may interfere with the emergency medical team's treatment plan. Finally, do not let the person lie completely flat or fall asleep. Keeping their head and shoulders slightly elevated, at about a 30-degree angle, helps reduce pressure on the brain. It's also vital they remain awake and as alert as possible. This allows them to communicate with paramedics and helps the medical team get an accurate assessment of their neurological state the moment they arrive. By carefully avoiding these common mistakes, you create the safest possible bridge to professional medical care, giving the person the best chance at a better outcome. 4. Prepare for responders. If you can do so safely, there are a few quick steps that make things easier for emergency teams. Unlock the door or have someone close by do it. Keep your phone within reach in case dispatch needs more information. Have your medication list or medical ID accessible. And most importantly, note the exact time the symptoms started. This detail helps doctors decide which treatments are safe and effective. Small steps like these save valuable time. Final guidance and prevention tips. A stroke can be frightening, but knowing what to do gives you control during those first critical moments. Recognize the symptoms quickly. Call for help without delay. Use the 3-minute head elevation trick to support the brain. Avoid dangerous actions. And prepare for the responders who will take over from there. Finally, talk to your doctor about your personal stroke risk factors, such as high blood pressure, diabetes, high cholesterol, and atrial fibrillation. Managing these early is one of the strongest forms of prevention. If you found this information useful, share it with someone who may need it. Knowledge saves lives. Stay informed, stay prepared, and take good care of your health. If you found this information useful, share it with someone who may need it. Knowledge saves lives. Stay informed, stay prepared, and take good care of your health.